Cannulation is when you put the needle in the arm, and that's necessary. We have to place 2 needles in the patient's arm in order to have them start dialysis. We'll have a needle that takes the blood out, and then we have a needle that places the blood back into the patient's body. With our job, yes, the needle seems to be the scariest part. They are pretty big needle sizes compared to what you're normally seeing at doctors. So it was a bit scary to get over the fear of how big it was and the fear of hurting the patient. I overcame it with just having that one-on-one practice with my preceptor and them just having me continue to practice. We have with him is a 15 gauge. It is a pretty big size gauge. Putting the needle, we need to go ahead and just insert and hold the needle, secure the needle. Now we can go ahead and insert our second needle, which is our venous, and this is the needle that will be returning the blood to the patient's body. Same thing, going down. Once you get that flash, it means you're in the access and it's flowing very well. Now we can go ahead and secure it. We are here to help and making sure everything that we do is safe and make them comfortable and making sure that we have a successful treatment for each patient.